Hi guys, today I just want to talk about shoulder issues and how we go about looking and maybe diagnosing what is going on. We get a lot of inquiries regarding rotator cuff. I've got a rotator cuff injury, and quite often it's not the actual tendons of the rotator cuff. Just as an example here, I'll show you the rotator cuff. There's four tendons. One is, if you can see, I don't know if you can see this, but that is supraspinatus, one of the most common ones to get ruptured in the shoulder. Then you got teres minor, infraspinatus, and then subscapularis comes on the front. So basically, when we're assessing the shoulder, we look for the range of movement. We then test the muscles of the rotator cuff for weakness and pain. Another area which can be involved, which is the subacromial bursa, which is this little thing here. Now, a bursae is a little fluid-filled sac that anywhere where you have two bony surfaces meeting, you've got a bursa, or if you've got a tendon attaching on a bone, you've got a bursa. It's an anti-frictioner, so it stops the rubbing. So, getting back to the shoulder, first and foremost, if you tear a tendon, normally you will hear a big pop, and it's quite excruciatingly painful. So you would know you've done something severe. If you get tendonitis, i.e. an inflamed tendon, that's a bit different, and a lot of people come through the door saying they've got tendonitis, being referred by somebody else or whatever. When we test, there'll be weakness and pain on certain movements, but then it still could be the bursa involved. So the biggest differentiation is called the distraction test, whereby we do the same tests for the rotator cuff, but we distract the shoulder in the joint. And basically, if there's more power and less pain, that indicates that the bursa is involved. The tendons could still be involved, but it's the bursa which is prevalent. So then we can obviously take non-steroid anti-inflammatories, or if that doesn't work, then we need to possibly inject with corticosteroid to reduce the inflammation in the bursa. And a lot of times that will actually get rid of the pain, and then we can work on the mechanics of the shoulder to get full resolve. Hope that helps a bit, and basically just remember that not all shoulder problems are rotator cuff. They can be other things as well.